Topic for today is sperm selection. We've got a small YouTube channel for embryologists. Then we offer some COVID scholars. Another one we are picking up is antioxidants in ART now. That's going to be very, very interesting. Using the pregnancy rate, it's not only the beta stage rate. Picking up the technology by which we can just, prepare the sperm properly so that we get an experimental, some we are doing, and find out a way where we learn the medicated. So we have to know that ideally only one sperm with a high chance of fertilization should be picked up. Just a basic picture, the survival of the fittest. These are a few numbers about which we are quite aware about. These are from WHO 2010. Remove a lot of sperms, and zona palisada will remove some other number of sperms. So you find that the majority of them, they are filtered out. Called chemotaxis. Then we use we have something called thermotaxis using temperature. And nowadays people are talking about using, and we can also create small microchannels. So we take a plastic plate, make very fine microchannels in them, create fluid flow and ICSI and selecting the good quality sperm and seeing them under 200 to 400 magnification. The common answer which we green is just pick it up. So like view is the concept of zeta potential, where negatively charged sperms will go to the positive the tube surface, bind with it. They won't move ahead. All the WBCs will get stuck here, and only good sperms will go, and this is the ideal method to be used. Now coming to the sperm apoptosis, I'll again come. I showed you a good sperm is moving like this towards us. It is moving like us, and we normally read these proteins everywhere. A bad sperm, it will have broken membrane, so it will come like this. So it will move like this. So the inner membranes of the sperms are exposed and they can be read. So we try to read these membranes now. So any sperm which has got a damage, these membranes can be read, and then we know that this is a bad sperm. That's the concept of apoptosis. Apoptosis means the membrane opens up. It is damaged. Okay, so how do this technique work? In case we have, just be with me for next few minutes. It's a very important concept. We have this sperm which is now moving. So what we do is that we just open. In case sperm is normal sperm, it will got proteins present everywhere. So they will keep moving. But in case some sperm has got a damage here, what will happen? It will be something like this. In case this is the sperm membrane, it will just open up like this. It will open up at various places. So now when this sperm is moving, we are able to now here in this case, we are able to encode these proteins. And these proteins are nothing but they are called phosphatidyl serine. They're called PS. They're called phosphatidyl serines are present here. And in case we are able to read these PS molecules here, we are able to know that sperm is apoptotic. Very simple logic. You all have been reading it about it, but I thought I'll tell you in the class. And in case we add something which can bind with phosphatidyl serine, we know that it is exposed. Normally on a sperm membrane, we'll never get PS. PS is negative. But when sperm has got a damage, like the membrane has opened up, in that case, we will get PS positive sperms. Phosphatidyl serine. So we use annexin. Annexin B we use, and this annexin will go and bind. Annexin has got a very good propensity to bind with phosphatidyl serine. Annexin will go and bind here. And then we use small iron beads. So any annexin which is binding to phosphatidyl serine will bind with PS. So we'll have something like PS binding with annexin plus magnetic beads. They are iron beads. They'll form a complex. And when the sperms are moving, in case we apply magnetic field, all these sperms will go and bind with that magnetic field. And the good sperms which don't have a damage, they will escape through. works, we find that magnetic substances are being coated. Now this is called annexin protein, annexin V, I've told you. They are coated with a magnetic substance. This will form a very good binding surface, and this will bind with the sperms which have got damage. So here we'll find that the damaged sperms are the pink sperms. They have got damage to their membrane and their phosphatidylserine residue is exposed. So they both will bind with each other. When you take them through a magnet, they will all bind with the magnetic bond. And good ones will wash. We'll flip through. We'll be able to use these ones for IVF. So this is called the magnetic binding. And I'll give you around 10 seconds here or 30 seconds you take. Read this slide. Just read the slide. Read the slide and then I will move ahead. Read the whole slide properly. And this is a good technique, but presently not available freely in our country. It's a good technique. Just see this picture. Assimilate, close your eyes, take 1 minute and then we will move ahead. Can I move ahead?
Yes, sir.
This is the PS, damaged sperms, blue one, right? So these are simple things, but normally people don't know about these things. And in the classes, we don't talk much about. So I thought we'll cover these things up in a curtain raiser. Just read them once yourself so you feel more comfortable. There's one concept about which you should all know. So I brought it up here. So the concept of phosphatidylserine, annexin V, then magnetic beads, magnet is the concept of separating sperms on basis of sperm apoptosis or magnetic sperm separation. These are pictures I've taken from one of the very nice articles. These articles are already with you. This article has been given to all of my friends in ICSI. You can go through the sperm preparation techniques article. I've copied from there. Okay. Second concept, I'm very fond of speaking again and again, and we spoke about PIXI and we spoke about sperm flow is about hyaluron binding assay. Here we have learned that when the sample comes, the sample is being capacitated by contact with the media or by doing centrifugation, and then we expose these sperms with hyaluron. So can someone tell me, just recapitulate, in case we make the sperms, put the sperms in the media which contains hyaluron, what will happen to that sperm? Suppose we have a drop of media in case we put a sperm, and we make one more drop in which we add hyaluron. What would be the difference in the sperm's movement in the both? I'd like to ask you.
They will move toward the hyaluron. Good sperms will move to the hyaluron drop.
Good sperms will bind to hyaluron and the others will keep have a motion forward, progressive movement.
So the motility will reduce in hyaluron. Fine. And why does it happen? Why does the motility reduce in hyaluron?
Hyaluron is little viscous solutions.
Due to viscosity, highly viscous solution.
No, because they bind to hyaluron.
They bind. Viscosity is one thing, but they bind to hyaluron because they've got hyaluron binding receptors. Fantastic. Very, very good. So we use such dishes like PIXI. We were using, I did around lot number of cases with them initially, but now they're coming in a bit of dispute. Not many people use it, but it's a one technique of hyaluron binding assay. This you can quickly read. The hyaluron is present on the OCC complex, and the binding sites for hyaluron are present upon the sperm. So they both can go and bind to each other. A mature sperm will bind to hyaluronan on the egg, but an immature sperm won't bind. The smoother the binding, the firmer the binding, it will tell us that hyaluronan content is okay and sperm binding is okay. So this is the physiological selector. This is the physiological selector which we want to mimic in our laboratories. There are two ways of doing it. We can use a pixie dish. Here again, I will repeat, I'll reiterate, I don't work for any pharma here. But these are the things which are being made by a company, so I'm telling you company's name. Otherwise, I'm not part of any pharma. Sperms are bound with the hyaluronan in the dish. It's called a pixie dish, physiological pixie dish. Or we can use something called sperm flow, which is sort of a media in which we can use something like we use PBP, we use sperm flow. The sperms which get bounded with the hyaluronan in the sperm flow media, they can be selected. So, well, these are the few slides available, which we were using initially quite frequently. But gradually we are now moving towards ICSI. So we don't use these slides, and they are the HBA binded slides. So they actually put some HBA coating on this, hyaluronan coating on this. And because we add a sperm here, we come to know how many of them are binding with the hyaluronan. More the binding, better is the quality of sperm. So after now, we've spoken about the apoptosis or the magnetic cell sperm separation. We've spoken about hyaluronan binding. We come to microfluidics. We come to microfluidics now, and in the microfluidics part, we have got basic principles and appeal of microfluidics, and this is the way it is made up of a plastic called it's a polymethyl disilicon, and it's got small wells present here. And there are small channels present here in which sperms, they travel and they move from these channels, they move to this channel. Simple concept, I'm not going into the details, but you should know what is microfluidics. So here we create a laminar flow, we create some resistance, we may apply rheotaxis to it, and we can apply some pillars which won't allow sperms to move further, will break their flow. So we are able to pick up good quality sperms by using a technology called microfluidics. And this is a technology which is the one which we are using every day. This is no doubt about microfluidics at all. So no dispute, this is available, not very expensive. We use it for both IUI and IVF. And even so basic concept is that we don't centrifuge the semen sample. There is no centrifugation. That's the basic concept. So that's I'll leave it here, but just know that there's a technique called microfluidics, easily available. We do it every day. It's a green color. I mean, we can use it without going into any dispute, and it can be used both for IUI and IVF. And the advantage here is that we don't do any centrifugation. So lovely technique, and you can just shift to it with a blind eye. So they just can give us a laminar flow like this, and the sperms, they move in particular stream, and the good ones will keep moving in a particular stream. A better stream, they'll keep jumping against the resistance, but the bad quality sperms will keep going in a chaotic method and get lost. This is how we use these microchannels. This is the microchannel I'm showing to you. You'll find that we have the whole debris moving together, and then it close up how sperms will now move over from one stream, from one well to another well, and only good quality sperms will move up and the bad quality sperms will go in this well. It's a technology which is working pretty well, and you can pick it up. Sperm birefringence is again a research, but has a potential in case it happens. Just remember that a good sperm has got good organellar arrangement, a dense arrangement. So when we see it under a microscope, we find birefringes, and for that we use a different type of a microscope, which will talk about the anisotropy of the protoplasmic texture. This is the way it works. So we pick up a sperm which has got good birefringes, and this is like a good sperm, which is shiny, When pick it up, this is an abnormal sperm, it can be ignored. Again, it's a new criteria, but it came up from Europe, came up very well, but now it needs a polarizing light microscopy. So not many people use it, but it can be a good technique in case we have polarizing microscopy, but primarily for research. 𝐒𝐸MC is a good technique. 𝐒𝐸MC gives us the magnification of 6,000, came from Israel. Came up in a big way where we could look at the vacuoles. As for my andrology class, you know that we talk a lot about vacuoles and sperm selection in morphology. We have around 1 hour on this topic every time. And we come for hands-on, we keep talking about morphology. So 𝐒𝐸MC will give you around 300 to 400 maximum. I think 200 is good enough for me to carry out an 𝐒𝐸MC also. But for 𝐸MC, we go to 6,300 magnification on average. So you can look at the nucleus and their vacuole. Here we can only see a sperm, but here we can see their vacuoles also and pick up the good quality sperm. That 𝐒𝐸MC came up very well, fantastic technique, and it could pick up the small defects everywhere. And basically we were applying a technique called MSOM, motile sperm organelle morphology examination. We call it MSOM. But I would like to say that now 𝐸MC is not being used. Well, actually deleted. 𝐸MC nobody uses nowadays in our country. Now understanding the perspective, which is very important. This can be our perspective. We want to help the patient by doing something more. We want to give them better treatment. But remember, whatever we do should be auditable and should be having need to treat. It should have reproducible outcome. And the outcome can be in the terms of clinical pregnancy rate or live birth rate. Don't pick up a technology because that is available to you. That's not the right thing to do. Big problem is that patient is expenditure. And once they spend rupees 10,000 on a technique, on 𝐸MC, in case you buy an 𝐸MC, you charge them 10,000 rupees, or you want to, some people use laser shots. Expectations are high, and that should be coming to the result. The result should improve. In case the result doesn't improve, the technique is not good. So we have spoken about these things, and multiple techniques are available to us. We got DNA fragmentation, we got magnetic sperm separation, we've got hyaluronic binding assay, we've got morphology assessment, we've got microfluidics. So multiple techniques are available to us. So let's see which are good ones. Just remember that 𝐸MC is out. �PICSI is also on the verge of being out. We don't use �PICSI. 𝐒𝐸MC is a good technique, definitely green. HOS is a green technique. Magnetic sperm separation, I feel on my side, it is in the amber. It is expensive and not many people, it's not easily available. But I think we can utilize 𝐸MC magnetic sperm sorting for IUI or IVF. We can use this technique, but presently it is an amber. I don't recommend you're going to it directly. Double density gradient method is the perfect technique. DNA fragmentation becoming greener now. Microfluidics is definitely green. Zeta potential in amber, we need more research. And so thoughts I leave for you today after I have spoken to you is the technologies are many, but majority of the data available to us is anecdotal, heterogeneous, and they are from the underpowered studies. Pick up the technologies which are actually good for the patient. Patient want consistent evidence-based result. Don't experiment on them. That is not the right thing to do. Don't be carried away by patients' expectations, market forces, and online info. Learn to say no. Don't come under pressure from patients and commercial interests. That is not the right thing to do. Everything which we add, new tests which we add, should have a reproducible outcome. I don't say that we don't do research. I'm the first one to pick up any topic of research coming to our country, and I'm doing it from the past 20 years. Anything coming, I'm the nearly first one to pick it up and do. Maybe vitrification, ovarian cortex, I'm the pioneer. But now, that's for research. Don't try to keep pumping in PRP in the testes, PRP in the glands, or PRP in the ovaries and say it's going to do magic for you. It is an experimental technique. So I want to limit ourselves and myself and my students to have. So this is a density gradient is a good technique. Swim up is a better technique because it doesn't involve any centrifugation. HPA binding is a good technique. This is a good technique. This is the one which is actually gone. We are not using IMC, we're not using MSOM anymore. Magnetic sperm separation not easily available, but this can be a good technique, and HPA binding is a good technique. I always say you can use that. Getting the right sperm is a big challenge for all of us. The current evidence which comes from the various articles, they say that in case you look at the future, I think zeta sperm selection may be good because this has increased live birth rate by some studies. So this is a good technique, and I think when it comes, let's move on to zeta potential. It's a very simple technique. This will be a good method for us. Using hyaluronan and ICSI is not a good technique as per Cochrane. And then these other techniques also don't add much to the clinical pregnancy rate or miscarriage, reducing the miscarriage rate. So hyaluronan binding, ICSI are again debatable. So I think I'll end my talk here. I've taken around 1 hour and 10 minutes for you guys. Thank you so much for joining in such large numbers. And we touched a number of around 208 or 209 today. We are still at 190. And it will be my great honor to invite you for our next curtain raiser, 20th curtain raiser, which will be on antioxidants in ART. It's going to be a very good curtain raiser. Then we have one on PCOS in ART. So with this background, I'd like to stop sharing my screen and we'll take a lot of queries. We have around 15-20 minutes. We'll take some queries from you guys. I'm open to any questions.
Any queries? No queries in the
Sir,
chat.
can I ask a question?
Yeah, please ask. I request all of you to put on your cameras now.
Sir,
please put on your camera, then we can see each other and talk. And Akriti, there may be some queries about which I may not be able to take them. So keep noting them down. So we'll send them the relevant, do some research and send them the relevant articles. That's what we always do. And in an hour or so, we'll try to send you all the relevant articles on sperm preparation techniques. We'll put them in the group. And that's what we do in every batch. They'll be sent to you. Yes, I'm open to any questions. We'll take around 15 minutes of questions now.
Sir, cost of max machine?
Cost of max is not available in our country. When the max came, they said you buy the beads from us. They were giving us the beads, and they were giving us the reagents. But the machine they were giving more of a complimentary basis, FOC. Use them and you return it back. That machine doesn't have much of things. Magnetic sperm separation is basically it's a test tube holder around which they have applied magnet. And then they put a pipette, they make a small opening below from which the sperm sample, which is not binding, is going to flow down. So cost, we have never bought it in our life, and I don't think it was ever available for buying in our country. I won't name the company which brought it out, but they are not supplying it anymore. So cost, I won't know. And the one test of max, as far as I remember, around 3-4 years back when we actually started working on them, was costing rupees, I think around 400 to 500 rupees per test, or 600 per test, not more than that. So max is not available to us as far as I know.
So where to get microfluidics?
Microfluidics are of this one technique which we are using day in, day out. So microfluidics can be for IUI and IVF both. There are 2 companies making it. Again, I won't go to the companies, but just remember that 2 companies make it. One makes for both IUI and IVF, and one makes only for IVF. So for anyone who is only doing IUI, थोड़ी महंगी होती हैं. They cost around 3,000 plus. It may even touch 5,000 to buy a single kit. That's for IUI. And the it's a very good technique in case you want some literature. I'll send you some literature on the group, and it's somewhere around 3,000 to 5,000 rupees. And there's one company which sells it for rupees 1,500. That's only for IVF. But that's a good technique.
Sir, can you send the contact number of the company so we can hire it?
I always do it, but I always say that contact me personally. On the groups, I don't talk about companies. You know it. I'll do that.
Yeah, I know it's. But
it'll be done. Just send me a WhatsApp. I'll give it to you. I've always done that personally.
Thank you, sir.
This is an academic background, and I don't need to be linked with any pharma at all. Then I will lose our touch.
Good morning, sir.
Hi, Pradeep. क्या हाल है? How are you doing? Working?
ठीक है सर. सर एक क्वेश्चन है माइक्रोफ्लूडिक के ऊपर में.
बोल रहा हूँ.
सर IUI में माइक्रोफ्लूडिक का यूज कैसे करेंगे? अगर 20 माइक्रो ही लीटर हम लोग यूज करते हैं मीडिया स्विमर को उसका मतलब गुड स्पर्म कलेक्ट होने के लिए, तो हमको IUI के लिए मोर देन 6 चाहिए ना?
Just give me 1 sec. Just give me 1 sec. I'm here. Let me share my screen. Let me share my screen with you guys, and I'll show you something. Can you see my screen now? I'm showing you a picture. Can you see this picture?
Yes, sir.
Yes, sir.
Yes, sir.
This is the IUI Microfluidics kit. Now, in case you get time, go to our YouTube website. This is our IC website where you got a video of this. So it's made up of in case I can draw here. Yes, it is made up of just pick up the color in case. Yeah, it is made of a plastic, and in which you can add the semen sample from the, I can't write on the screen somehow. So you add the semen sample in the green hole, and then it's got a membrane, the polycarbonate membrane it has got. The blue is the semen sample which has been added here. See this? Here we add semen sample. The semen sample is the inlet. Sample will go like this. And then it will come out through a well and give you a good number of sperms. And this is meant for IUI. It's IUI kit. So this kit is different. And this kit, some people are selling it for rupees 5,000. The advantage here is that all of you sitting in your OPDs can do this technique, done at room temperature. Just take the semen sample, put it in this, and you easily get around, you get around 300 microliters of sperm. Just put it here, it will flow down and then come up. This you use for doing an IUI. ठीक है Pradeep? This is an IUI microfluidic.
Yes, sir, I understand now.
ये महंगी होती है.
हाँ, मैं थोड़ा कंफ्यूजन हो गया कि जो हम लोग ICSI के लिए माइक्रोफ्लूइडिक यूज करते हैं उससे, लेकिन ये तो डिफरेंट ही है. Thank you for
different concept. I can send you the pictures. See what happens here. I don't want to talk about companies because that disrupts my thought process. But in case any one of you wants anything about on my personal number, send me a WhatsApp. I'll send you all the details. You can buy from them. They are available in our country. Advantage of microfluidics and IUI is enormous because here we take only 15 minutes. Your sample is ready. Work at room temperature 28-30 degrees centigrade. No centrifugation, and that will eradicate requirement of Dr. Pradeep. He won't be required. Eradicate my requirement.
This would obviate the need for other things in IUI, laminar flow, the microscope. You don't need anything.
I feel that laminar flow is important for us. Many people do IUI without laminar flow. Actually, laminar is important, but overall there is no jhamela. Just take the semen sample, take it, you watch our videos, you'll come to know what I'm saying. Videos are there in our YouTube channel. Just take the semen sample, inject in the well and leave it. And sometimes just take the semen sample and use it. It's a beautiful way to do it.
Can I say something?
Yes, sir.
Sir, can we use this? I'm using this the same without a centrifuge in IUI, where I'm just underlaying the semen 1 ml or 2 ml in a 2 ml of media and waiting for 30 minutes. I get a supernatant, I get it, which is absolutely very clean, 100% motility. Sir. And I use it without having any centrifuge, where I don't have to use this 5,000 kit also. Sir.
Yes, that's what I'm saying. No, how do you do it? Without a kit? How do you do it without a kit?
Sir, round bottle test tube, 14 mm, where I take 2 ml of media, okay, straight, and underlay the semen 1 ml, and wait for a swim up for 30 to 45 minutes. And after a swim up of 30 to 45 minutes, I take up only upper supernatant of 0.5.
No, Dr. Gupta, you had gone totally on a tangent. This technique is 50 years old, which you're talking about. This technique has got a problem. See, there's a concept of microfluidics here. You are talking about plain, simple swim up. Swim up is one of the 4 techniques which we teach to our people who come to us. I think today from 11:30 to 2:30, we got a class on sperm preparation for C2 batch, E9. So what you're talking about is a swim up method. That method you don't centrifuge, I agree, but there's a different technique altogether. What we are talking about is microfluidics. In microfluidics, there are microchannels. There is rheotaxis. There are pillars which will break the flow of the sperms. There's a polycarbonate membrane. Getting the point? This is the 5th generation device. What you're talking is plain, simple swim up, which we can do it in our laboratories. Anyone?
That won't take care of the debris.
Yeah, correct. The debris may come.
Debris doesn't come, sir. If you pick up 0.5.
Morphology nahi aati na. Dr. Gupta, there's a different technology altogether. What you're saying is very right. Nowadays, we don't centrifuge at all. But there's a different technology altogether. What I'm talking about. But what I'm talking about is Tesla car. 1 CR. This is a new technology, absolutely different technology. So what you're talking about is sperm moving up towards emptier space, जहाँ पे उसको अच्छा खाना मिलता है. See, how do I teach people? A simple logic I give to you guys. In our andrology batch, I focused on this. Sperms go up wherever they get good food. We have less number of people. I normally ashrams and ghats. I show people those pictures. Sperms move up towards where they get freedom to move. Where they have more food, they'll swim up without centrifugation. And I again tell you here, Dr. Gupta, don't wait for 30 minutes, wait for only 10 minutes here. This technique which you're doing, you'll find dramatic change. The more you'll wait, you'll get more bad sperms. So here, sperms are swimming up, number 1. Here you collect the swim up, not supernatant.
Yes, sir, supernatant.
Swim up. So हम जो बात कर रहे हैं एक ऐसी टेक्नोलॉजी की जो कि PDMS डिवाइस से बनती है, जो तकरीबन 4-5 हज़ार की आती है. इसके अंदर माइक्रो चैनल्स होते हैं. माइक्रो चैनल्स के थ्रू स्पर्म स्विम करते हैं अगेंस्ट द करंट्स, एंड देन दे पास थ्रू ए मेम्ब्रेन व्हिच इज वेरी एक्सपेंसिव मेम्ब्रेन. It is costing ₹3,000, and they've got micro pores, micro channels, rheotaxis, microfluidics, obstruction. Then what comes up are very, very clean, high quality sperms.
This is over here, sir. A small doubt on.
You tell us, you are an andrologist.
No, sir, small doubt. Sir, like if you are using this microfluidics, will there be any lowering of cutoff for the sperm selection for IUI? Because we have, when there is a density gradient, we say this one of sperm should be there, morphology or motility should be there. Can we compromise on those things? Do you have any lower cutoff of this?
The cutoff is very clear. When you were in the classes also, we had spoken that cutoff for me is 3 million for IUI. The cutoff for IUI, some people do IUI at 1 million also. Some do it, they take post-wash sperm count of 3 million, some take 5 million. For me, cutoff is 3 million of good quality sperms. Since 3 million, I don't carry out an IUI because an IUI cost pricing for me, it's somewhere around rupees 18 to 19,000 rupees. That's the IUI pricing because all the hormones, 8,500 rupees for the IUI procedure, injections, those HMGs, consultation, 3 ultrasounds. So for at any good center, in a tier A city, we are billing people somewhere around 15 to 16,000 rupees for an IUI. I think you all will agree or disagree. In a tier B cities, it may be around. Dr. Sumita, how much do you bill the patient for an IUI? Or Dr. Gupta anybody can comment. I can see you guys, so I took your name.
Sir, 20,000.
You're always very, very, Dr. Gupta, Bilkul, you talk on the dot without mincing your words.
So practical point.
You're truthful. You're so truthful all the time. Thank you.
Thank you, sir.
Sir, one small doubt in this. Is there any lowering of cutoff for this sperm selection? If you do this,
it can't be there. It can't be there. See, these sperms have to swim up, no? So 3 million count, the probability of their reaching the egg is very less. So
but when we better sperms, no, sir, with using microfluidics.
There is no study over this still. The last articles which came from ASHRAE were in 18, were in 9, 14, and I think 18. All these articles have been given to you. They don't talk about microfluidics till now. I don't have any cutoff. Maybe some cutoff will come later, but till now there is no cutoff. But for IUI, take in your mind, cutoff is 3 million post-wash motile sperm counts.
Or even for after max and also for microfluidics.
We don't know about max. There are no figures at all. There are no figures. There is no article which says that what is the cutoff on that. I'm sure in the world there is no article available. And they are not available for clinical application also. The microfluidics for IUI, we started around 3 years back. But later on, we had to leave it because it was becoming a bit expensive, rupees 5,000. So we left it. Because kya hota hai? When you prepare an IUI sample, we spend rupees 5,000 on the equipment. I mean, the media and the disposables and the tubes come for rupees maximum 500 or 550. So out of 8,500, which I always say we should actually drop the rate for IUI. I don't know why we don't do. Out of 8,500 we charge, or rupees 9,000 or 6,000 or 5,000 we charge, only 500 goes towards the equipment. Rest all is the technology's part, the role of the andrologist, or we can do it. But in case you buy a kit worth rupees 5,000, then what will happen? Tell me.
So any advantage of buying that, because the cost comes when the patients are fine. But for us, is there any extra benefit to use microfluidics?
Definitely. In case you want to do truthful IUI, it's always see for a busy center. Why do you want to use centrifuge? Normally we centrifuge once or twice. We do centrifugation, we take swim up, we take 3 tubes, 2 pipettes, a lot of things we do. We are centrifuging it for 10 minutes and then 5 minutes, or swim up for around next 20 minutes. You need 1 hour. Most you need 1 hour for that, and 1 hour means somebody sitting with that sample. With microfluidics, it's something like sperm counter, CASA, the portable CASA, which many times we discuss. Just put 1 drop and get the printed report. Why do you want to sit with it for everything? So now time is premium. Post-COVID, definitely we've run a time is premium. In that amount of time, you can do much more work.
So for this, even like you should be using washed sample mostly.
Yes.
Wash sample is a compulsory for you for microfluidics, because what I'm saying is
no. You can take the raw sample. Take raw sample. Washing hota hi nahi hai na. That's that. In microfluidics, there is no washing at all. There is no washing in microfluidics. After you wash it, then the microfluidics purpose hi nahi reh jata na. As far as possible, we need a raw sample in that.
Whole raw sample, sir?
Yeah. Tabhi to we get good sperms without washing. See, what is the role of microfluidics? We don't wash. We don't centrifuge.
So this is good for non-gynecologist based center. That's one thing, right?
Non-gynecologist?
I mean non-embryologist based center.
No, you can use microfluidics for 𝐒𝐞𝐫𝐸. We are using 𝐒𝐞𝐫𝐸. We use microfluidics very routinely.
Okay.
You can use it for any patient, but for IUI, it's a really good process because you are sitting far away in some tier B or tier C cities, which are not in Delhi or a big city. You don't have a technician, you can do it yourself.
Okay.
It's so comfortable.
Understood.
So that's the advantage of using microfluidics. थोड़ा महंगा होता है, I told you, it costs money. So that's
Sir, then it will be useful for OP setups without a proper IUI.
100%. It's a lovely technique. So many people, you see, so many people are doing this work, but are they having an andrologist? Are they having an embryologist? They don't have. So they do it themselves only, or they call some technician who doesn't know the work properly. Better is that you do it yourself. You got a small lab, you do it yourself.
So only microscope and this microfluidic.
In case you can buy or spend rupees 80-90,000 and buy a laminar flow hood, nothing like it. That'll give you safety.
Sir, with the microfluidics, the immunological factors and seminal problems remains as it is.
Yeah. See, in case you look at the immunological factors, so we cannot separate, no? And what we can separate is, see, one thing is very clear. In case you read all the literature, any sperm which has got good morphology, that will be having good DNA. That sperm with good morphology, good DNA will be able to swim better in the microfluidic channels. And they'll be able to undergo rheotaxis. So these sperms will always be good quality sperm. Now looking at a sperm which has got an immunological factor, I don't think antibodies have, this is going to select it. But a good sperm won't have any antibodies. Looking at that way, on the contrary, good sperm will be good morphology, good DNA, good penetration, good HBA binding. This has been proven again and again. That case,
do you recommend centrifugation or no?
Never. Centrifugation should go gradually now. We are moving away from centrifugation.
Okay, for all 𝐒𝐸 patients, you do microfluidics.
For 𝐒𝐸, no, not for all. We do centrifugation. But gradually, see, patients cannot afford. No, all the patients cannot afford also.
Yeah.
I cannot give a blanket statement, but time is coming when we have to move towards microfluidics. Now, in case I get a patient who's got a poor sperm motility or has got a bad morphology, morphology less than 2%, 3%, he's got more number of immotile sperms, they have given carnitines, and then I start centrifuging them, I'll be an idiot. So there is, as presently, is case selection. Like we do centrifugation, but any patient who's got an abnormal sperm counts, we always go in for microfluidics.
Yes, sir. And for sperm, also instead of centrifugation, if we let the raw sample and take it.
Exactly what Dr. Gupta said is very right. Dr. Gupta said a lovely thing about swim up. I didn't want to go to these old techniques today because these are old techniques. I didn't want to go to those things, but this is a lovely technique. So all the samples which are normospermic as per WHO, we do plain simple swim up for 𝐒𝐸. But here, Dr. Gupta ko maine ek cheez boli thi ki we don't do it for 30 minutes, we do it only for 5 minutes. 8 minutes, you'll get good number of sperms for 𝐒𝐸. We only need 10-15 sperms. The more you will wait, more bad sperms will come up. So 8 or 9 minutes, pick up a sperm and finish it off.
Okay.
The swim up Dr. Gupta brought out, it's a lovely technique, fantastic technique. This is what we normally follow. But that is not good for a poor quality sample. Then again, there can be a problem. Good quality sample, we can do that.
Thank you, sir.
Please defend this poor quality sample for using microfluidics at your standards.
Yeah, 100%. In fact, I don't
because what do you mean by poor quality sample? Is it astenospermic or?
So the poor quality sample for us, most important for me is microfluidics. So is morphology. In case morphology is poor, it's a poor quality sample. Just remember that. Morphology has to be good, more than 4%. Because morphology percentage is good, then it's a bad sample. Then you can always count. For me is not very important. 10 million, 15 million count, I don't bother much because count is okay for me. Agar 𝐒𝐸 karna hai to. But definitely, yes, when we look at the sperm, the morphology is the key thing. And how many of them are motile? How many of them are PR? That's very important for me. In case I find that my immotile are more than the PR and there are pus cells present, then it's a bad sample for me, definitely. So morphology and the PR are two important factors which are important for me. Then DNA fragmentation is important for me, definitely. That's important for me.
By using this microfluidics, still the morphology is 4% and PR is 40%. 40%, right? So
yeah, correct.
So we can compromise on that.
We should not compromise. We should correct them. And after correcting them also, in case they're not getting corrected, the right technique here is microfluidics. With closed eyes, do microfluidics. Very simple.
How much volume will the microfluidic chamber will hold, sir?
Only for 𝐒𝐸, madam. Only for 𝐒𝐸. It's only for 𝐒𝐸. It's not for IVF routinely. But in case we are trying to go in for IUI, there are different kits available for that. But they cost more. An IUI kit will cost around somewhere around 4,000 to 5,000. And an IVF kit will cost around somewhere around 1,500 to 2,000 rupees. Yes.
How much volume will it hold, sir? IUI kit?
IUI 300 microliters will give to you.
Okay.
Sir, please one question, because I'm not able to complete the question.
Boli.
So there is 1.5 ml of sample. So can we put the whole into this microfluidics?
No, we don't take. No, depends upon which technique you are doing. We only add few microliters in a chamber of microfluidics. Whole sample is not required. No, I told you. They're either for IVF or either for 𝐒𝐸. There are two different kits are available.
IUI, sir.
IUI, put the whole sample.
That's what I'm asking. I'm thinking for IUI.
Difference. But don't put 1.5 ml or more than 2 ml because itna jayega hi nahi and the membrane will break.
Okay, so
but for IUI, take more sample, and for IVF, we need only a few sperms. So it's only for 𝐒𝐸.
So maybe 1 ml for IUI, sir?
Yeah, you can take that. Yeah, safely you can take that. There's no problem.
And even if the morphology is 3%, can we use microfluidics?
Yeah, it is meant for poor morphology. It is meant
for what is the cutoff, sir?
It is meant for poor morphology only.
So this is only one.
Yes, Nidhi?
My question, sorry, sir. Sorry for interruption again. My question is, can we choose it when the morphology is between 1 to 4%?
110%. I say choose, ideally, in case you have money, choose for all. But in case you want to be selective and want to spend ₹1,500 or not spend ₹1,500, then the cutoff morphology is the key factor. In case poor morphology, go in for microfluidics.
Because sometimes patient come in a lot of hurry, they don't give us time to correct the seminal pattern because, like very specifically, people working in Middle East, they have time only for 2-3 months. They come for the plan of IUI.
Yes. Then microfluidics is the best method to use. Best method is microfluidics.
Thank you, sir.
It's a known thing. Microfluidics, there is no debate at all.
It's easily available, sir. Microfluidics.
Abhi available nahi hai. Post-COVID is not available. We barely get one odd kits nowadays. Milta hi nahi hai. Something wrong with manufacturing thing, but it's available. Normally it is available in abundance, but now a lot of corporates and everybody is buying them in bulk. It's difficult to get. I'll give you the vendors' numbers. You send me a WhatsApp. I'll give you their numbers. Talk to them.
Yes, sir. Thank you, sir.
So one thing I just want to add here. For IUI, the cost of the abnormal and oligospermia, asthenospermia, they actually not indicated for IUI.
क्या बात कर रहे हैं?
नहीं सर, जो पेशेंट्स के स्पर्म ओलिगो, सीवियर ओलिगो, मॉडरेट ओलिगो या माइल्ड ओलिगोस हैं और जिनके मॉर्फोलॉजी भी कम है सर, तो उनको सर वैसे भी प्रेगनेंसी रुकने वाला नहीं है विद IUI. दिस इज प्रैक्टिकली व्हाट आई हैव ऑब्जर्व.
You're right.
ओके, उनको हर साइकिल में 20 से 25,000 रुपए खर्चा करना, 3 साइकिल्स में जहां पे IUI की परसेंटेज है ओनली 10 to 12% और मैक्स टू मैक्स 15%. इससे अच्छा बेटर ऑप्शन उनको पहले टेबल की कंसल्टिंग में ही मैं बोल लेता हूँ, यू हैव टू गो फॉर 𝐒𝐸. इफ दे आर रेडी दे कम, इफ दे डोंट रेडी लेट अदर्स लूट देम.
I always say that, Dr. Gupta, I just share my clone. I always tell you that. That's the right approach. Be truthful.
Yes. तो सर उससे 5,000 रुपए खर्चा करके उसको ओलिगो को, जिसका परसेंटेज ओनली 10 to 12% है IUI का, 20,000 रुपया खर्चा करके उसको 3 साइकिल्स करना, 60,000 to 70,000 उसका जाना, और उसके बाद उसको बोले कि नहीं अभी हम ICSI करेंगे. It's just like a cheating. Then
never do it. You should never do it.
It's absolutely. It's a IUI has been indicated only for normal spermia. This is my thinking of practical point of view. Other than abnormality of the sperm, directly go to ICSI.
We should learn how to say no, and
yes, sir.
We should always have case to case analysis. We learn to say no. Don't make them spend a lot of money.
Sir, 3 million count post आप IUI करेंगे. How much possibility they will go to get the pricing through? Because it is lot of involvement of mental involvement of the physical involvement, lot of stress the female is facing there if she gets again the menses. Forget about the money.
I agree with you, but I think we should all share your feelings, and you got the right feelings. Thank you so much.
Thank you.
It's not easier. I think we'll stop here. It's a long time because it's Sunday breakfast time for all of you. I'll take all. We can all. There are a lot of queries, but lack of time, and I'll request you to just put it on the group. We can talk. And now I'd like to invite Akriti. We can invite Dr. Sumita now to say to sum it up the whole day.
Yes. Now I would like to invite Dr. Sumita ma'am. Ma'am, we want to hear something from you.
Thank you, sir. Thanks for an enlightening lecture on a very important topic. And I wish we continue to hear many curtain raisers more. And that's the big initiative from your ICSI family, so that more and more people can learn and more people can join. Thank you so much, sir. Thanks a lot.
Thank you so much. So all of you have a wonderful day, a wonderful Sunday, and eat to your heart fill. खूब अच्छे से खाना खाओ, फिर खूब TV देखो और सो जाओ. Take a break. Okay, guys. See you.
Thank you, sir.
Bye.
Thank you.
Take care.
Thank you, sir. Thank you,
God
sir.
bless all of you. We'll